Today we'll be talking about coding and clinical documentation improvement and how those are evolving in post-acute care. So we talk about our auditing of our documentation. So CDI sets goals for improving patient outcomes and documentation. And there's nothing more tedious about conducting chart audits, or even frustrating conducting chart audits, when the same problems come up every single quarter or every single month and nothing changes. And we all know that that happens. And so you kind of feel like you're spinning your wheels while you're really doing that review. No, we don't do anything with the results of the review. So what we want CDI to do is to look at that information and make improvements from it, and look at working with our educators in a particular area, or even a goal, or even developing a certain type of a care plan. That's something that we want the CDI specialist to work with. And CDI, although they want all goals to be achieved, if it's not achieved, then what they then go back and do is they will drill down that data to find the reason or the root cause why this issue is happening. Is it an educational issue? Is it a people or person issue, or is it a process issue? So again, they want results, but if they don't get the results they want, they then will go with that root cause analysis. And then when we look at what do the coders do for the audits and the coding audits, that's really going to be based on correct coding that's in the EHR. And that's basically what we're doing right now. We're checking to make sure that what is coded is in our record, so that if we, again, had to send in our medical record documentation, we would be able to support that. So in the end, auditing is the key to quality patient care. It reduces legal risks, and it keeps us in compliance with our standards. So how do the functions for coding and CDI complement one another? Because as you can see, there's overlap. We are talking about some overlap with coding, some overlap with quality or performance improvement, and what CDI will be doing. And so how they actually complement one another is they're reading the record for documentation to support that diagnostic coding. So they're both reading it, but they're looking at it from a little different perspective. They both are facilitating the fact that the coding needs to be to the highest level of specificity available, and both are querying for detailed information, whether it's just specifically diagnostic information, or whether it is information within the notes section that is going to help support the medical necessity of that diagnosis. So as far as coding accuracy, correct coding is an essential element to any CDI program. So a CDI specialist does need to have some competency with ICD-10 coding. They don't necessarily have to be certified in it, but they have to have an understanding. And they have to be able to understand the official coding guidelines so that they can support the coding team and explain that to the clinician they're working with, explain that to the physician that they're working with. So they're looking for that necessary documentation of clinical indicators. CDI staff also need to understand that selection of what is the principal diagnosis and what are the other diagnoses or comorbidities that need to be collected, and what documentation does support that code assignment.